Hey everyone, my name's Ryan, and that's Bramble. And on August the 30th, 2025, I had a prostatectomy after being diagnosed with prostate cancer on July the 2nd, 2025. You've probably heard all the boring statistics, but I wanted to make this video to show you what it's really like. The good, the bad, and sometimes the slightly embarrassing. This isn't just about me, my story. It's about raising awareness, the effects on your family, sharing a laugh, and hopefully encouraging more men to get checked. After all guys, it's just a cheeky finger that could save your life. This is my personal journey from a simple blood test to life on the other side of the big surgery. So grab yourself a tea, coffee, a beer, a whiskey, and join me on my journey.
Woke up at 3, gotta go again. This tiny gland keeps messing with my day again. It's the size of a walnut, but it runs my life. Big decisions about the surgical knife. This is prostate cancer, from diagnosis to recovery. Me chose the patient, the fighter, he took the biopsy hit, still standing proud. Turn it up now, this is his crown. Prostate cancer, we're facing it with a grin. Stay tuned, the journey is about to begin.
Adding on to the fact after post-surgery, there are things, yes, I had my cancer was caught very early. I'm very, very fortunate. I'm very lucky that they found it early. It hadn't broken out of the shell of the prostate. Professor Imran Ahmed, he did an amazing job with my surgery using a robot, which I had previously knew nothing about. So the chat that I have with Professor Imran Ahmed, he goes through what he did on my surgery. And he very, very kindly gave up some time after he'd done 3 other surgeries that day for prostatectomies. And he came to chat with me and he explained how he did the surgery and all the 6 holes I had in my stomach and what his method that he used. It's very, very interesting. And I never knew anything about this. So it's a very good thing to watch for those who are due to go in for a prostatectomy with the radical robot. They call it the radical robot surgery, and what to expect and the aftermath. Now, 2 weeks after that surgery, I was out walking the dog, not high speed. I was shuffling, but I was out walking the dog. So the recovery time is very, very quick. 5.5 weeks after my surgery, I actually was flying off to Croatia and had a week's holiday with my wife. And it was fine. No issues at all. There are obviously side effects. Yes, the cancer's gone. Thank goodness. I had a PSA blood test taken but 4 weeks ago, and it turned out that my PSA was very low, zero reading, which is exactly what you need. And there are other problems, issues that you need to deal with after the cancer's gone, but for men and for males, and this is another reason why I wanted to put this video out, because I believe that men find it hard to talk about things, especially when it comes to health, and they feel a wee bit embarrassed about talking about it. But there's things that we as men after prostatectomy, we need to deal with. One is erectile dysfunction, and the other is incontinence as well, because the prostate supports and sits under the bladder like this. So it supports the bladder. So when the prostate is removed, your bladder drops, which gives you incontinence issues. And also with the radical robot surgery, it actually can affect your erectile function because it can damage your nerves. But luckily enough for me, Imran said that he'd managed to save all of my nerves. So, yes, I have issues. I'm not afraid to say it. I'm not embarrassed to say, but hopefully it will come back. Nerves take a long while to repair, but it will come back at some point. I've been very, very lucky and very fortunate that I have not had bad inconstant issues. I had a catheter fitted straight after surgery, a suprapubic catheter, which was straight through my belly, straight into my bladder. And in actual fact, that was the most uncomfortable thing of the whole surgery, was the actual catheter. So if you are going to have that robotic surgery, it's really nothing to worry about. To be honest, you actually heal up really quickly. It's just the catheter is just really bloody uncomfortable. Once I came out, I was fine. It takes a bit of effort getting in and out of cars for a number of weeks, but you do heal up really, really quickly from the surgery. So please do not worry too much about that either. You will be fine.
Pop them down a wee bit, just to your abdomen, exposing that site. That's fine, just there.
That's nice.
Yeah.
Beautiful. Right, do you want me to lie down,
Just
Bill?
lie there on that
All right.
table.
Smashing. Say goodbye to the bloody pipe.
Just wash my hands,
Oh, you bugger.
get some clean gloves on. Some clean gloves. Gloves are murder to put on when your hands are damp.
Right. This is the one thing that's caused me the most bother.
Yeah.
Out of all these
often-
holes,
Yeah.
that is the worst thing. And
Often the case.
Yeah.
Yeah. Doesn't really, it's really pretty straightforward scientifically. It's
Yeah.
a tube that's through the abdomen, through the abdominal muscle,
Yeah.
straight into the bladder,
Okay.
and can siphon off any excess urine, drain it out of the valve.
Yeah.
The idea being you close the valve for a while and then you start to pass urine spontaneously, normally. But you've always got the valve there as a safeguard
Yeah.
in case you need it. Mm-hmm. Yeah.
Yeah.
We'll remove the tube. The site, the entrance hole to the site needs nothing done about it. It will leak a wee bit of urine, but that will seal very, very quickly.
Yeah.
It can seal in an hour, 2 hours, 3 hours, or a couple of days, but it will seal up itself, so we don't need to stitch it or dress it or anything like that.
Right.
It's pretty straightforward. It should not be uncomfortable. You will feel this coming out. Yeah.
Do you know what? I can't wait to get it out, but I'm not looking forward to it actually coming out.
You will feel it coming out, right? But it should not be painful. It will not be.
No.
It will not be painless, but it will not be painful. It's held in by a water balloon,
Okay.
which has got 10 mils of water in it,
Oh, there we go.
which I am removing just now.
I felt that.
Yeah,
It was
you'll
like a...
feel a wee pop.
A pop,
That's
yeah.
that's the balloon coming down.
Right, okay.
Yeah.
Yeah. How big's that balloon?
10 mils it
10
takes.
mils?
Yeah.
Right, okay.
10 mils of fluid it takes, so I make sure that every drop of fluid is out, like so. Then I very gently put a swab there and say to you to count to 10.
Oh, you bugger.
But by the time you've counted to 10,
Oh, that was a good job, that was.
by the time you've counted to 10, I've removed the catheter and I've put,
Don't make me laugh, that hurts.
and I'm pressing that swab on there.
Woo! You've done a few of these before, haven't you, Bill?
I have one or two.
Just one or two.
Your catheter's out. Okay.
Yeah.
Pop your finger on that swab. Just
Yep.
press that for
Yep.
a minute. Yeah. I'm going to bin that.
Oh, I felt that coming out. Can't press how you yanked it out so quick.
Well, we don't want to be
I
messed
thought you were
about.
going to do it like dead slowly. That was more of a like a just yank it out. Fair play.
You want it to get stuck halfway. Hello.
Correct. It's got to just come out now.
Yeah.
If you move that swab, you take that swab, right?
Alrighty.
And you'll see that's leaking urine.
Oh, goes that piss?
Aye.
Oh, I kind of got piss all over me now.
Press that swab on.
Oh, it's not going to smell like Pishy Frankie from the town.
Press that swab on there.
Oh, sorry.
Right.
I didn't know. It's like, oh, of course. I thought that was a damp tissue. It's not. It's piss.
Now, I told you, that will leak.
Yeah.
And there's nothing we can do about that until that hole seals.
Yeah.
Yeah. So it will leak urine. And all we do now is we replace the pads as required.
Right. Okay.
Yeah.
Yeah.
Until that stops leaking.
Right.
Yeah.
Got you.
The leakage, it's pouring out just now because we've just took the... Yeah.
Yep.
Did you say you had some wee pads with you?
I've got a pad in my pants.
Right.
Tenner for men.
Right. This is what we're going to try and do.
Tenner for men.
I'm going to do this. I'm going to take another swabs. I want you to... Right, I'll take this one, right?
Yep.
Right, putting another one on. Right?
Yep.
Okay. Right, you press that.
Okay.
Okay. Just for,
Maybe I should stop laughing because it's just pushing it out.
just for
Stop making me laugh, Bill.
Just for security wise, what we're going to do is put a wee bit of tape across there. I want to try and pull that pad that you've got on. Just paper tape, right? So what's in your hand? Put that across there like that. See that pad that you've got on there?
Yeah, well, it's way down there, like.
Try and pull it up
I mean,
over top of that.
I can, like, pull it off.
Just put it there.
Yeah,
There.
yeah, Lou.
Yeah.
Yeah, cool.
Yeah.
Okie dokie.
Okay, that's it.
Smash him.
That's it. Up you come.
Yeah. Pish.
You stick that in your pocket.
For the
Spare
journey
swabs.
home, yeah.
Well, we'll maybe need them before that because I don't want you to go home right now. Because what I want to do is to make sure that you're passing urine spontaneously.
Yeah.
Yeah. Mm-hmm. So we'll sit in the waiting room,
Yep.
drink some water,
Yep.
go for a pee. When you go for a pee, come back in. I'll run a scanner on your bladder,
Yep.
make sure everything's okay, and then away you go. Yeah.
Okay.
You want to make sure that you're okay before you leave here.
Yeah.
Yeah. Whilst you're in here, you're my responsibility. Yeah.
Correct.
When you step out that door, you're no longer my responsibility. I want to make sure that when you go out here, as far as that everything's okay
Yeah.
when you leave here. Yeah.
How long do you think that'll leak for? Do you think?
I think probably by the end of the day that'll be sealed.
Yeah.
Yeah. Yeah. Because your recovery's been pretty good so far, and you're
Yeah.
managing to pass urine. And I'd just like to know that you've passed urine in a good volume.
Yeah.
Running the scanner on you is going to let me know if you've got any residual urine in there.
Oh, okay.
Yeah.
Yeah.
And if you have, we might need to wait a wee while.
Right.
But I don't suspect that you're going to have any
Okay.
residual urine. If you've got 50 mils, 70 mils or so in your bladder, fine. That's fine.
Okay.
You can go.
Yeah.
If you've got 200-300 still in your bladder, that's a different story.
Oh, right,
But
okay.
we're not going to worry about that.
Yeah.
Not at the moment.
Hopefully it'll be all right. I mean, I emptied it as I got here, so
Yeah.
and yeah, I don't think there was anything left,
Yeah.
so we're all good.
I would really stress if you are going in for a prostatectomy, whether it's the old-fashioned traditional way or the robotic surgery, then I do really strongly suggest that prior to the surgery, you get some sort of level of fitness, get out walking. As soon as you find out and you get a date, get out walking, get some exercise and get your fitness up as much as you can prior to the surgery. And also download an app which is availavailable on the iStore and the Google Play Store, which is called Squeezy. It's actually an NHS app. I believe it's made for women after they've had children, after they've given birth, to support and strengthen their Kegel muscles. Now, we do have Kegel muscles as males, but we don't really need to use them. But now the prostate is gone. There's a weakness down there, so you really, really need to get squeezing. Basically, squeeze, get that up and get practicing and get those starting to get some strength in them prior to your surgery. So getting some exercise. If you're carrying an extra wee bit of weight, try and lose a wee bit of weight as well, I would suggest. And also get the Squeezy app. I'll put a link in the description to download, because you need to, if you can do that and start practicing, it will really, really help with incontinence issues that you may have after your surgery. I was quite lucky because I walk about 24, 25 miles every week with a dog. So I was already relatively fit, and I'd been doing some running at the start of the year as well. So I was actually quite fit and I wasn't overweight. So I believe that helped a lot with my recovery. But get the Squeezy app, get practicing, get used to using those muscles. And it's basically all you're doing is, if you're taking a pee, when you're peeing, try this. When you're peeing, squeeze and stop yourself peeing. When you do that, that is what you're working, and that's what you need to do using the Squeezy app. So that's a really great resource to start using that. I can't stress that enough. And also the aftermath of the surgery with the erectile dysfunction is super important, that you get your penis working again as much as you can. You will be prescribed, if you're in the UK on the NHS, you can get prescription for a penis pump. And it's not the most dignifying thing to be using. Neither is it very comfortable. I don't know how people use them when they've not had one of these operations, this surgery. But a pump is really, really important to keep the blood flow going in there. If you don't use the pump, there's no blood going to your erectile tissue and it basically falls asleep. So you need to use that. It's really, really important to use that. Practice before the surgery as well. Get used to using it because it's not really comfortable to use, but it's super, super important. So I'll leave those thoughts with you there. And like I said, I hope you enjoy the video. And please, please reach out if you have any questions, any concerns about your diagnosis and you want to talk to anybody. There are support services out there, but drop us a message. I'm happy to have a chat with you and give you some advice. But from what I've said, those three things, really big advice to take. So I shall leave you there, and I really hope you enjoy the video, and please, please, please share it with your loved ones, your friends, family, any men that you know. If you have symptoms yourself, go and get checked out. If the GP says, no, we don't do PSA blood tests, tell them to get stuff, to get one done if you're worried. It's your health, it's your body, you know it, get checked. So please like, share it, comment. I will reply to you, I promise, as long as I'm not working. But please do take care of yourselves, guys, and please get checked. And we shall see you soon. Thank you very much for watching.
So the gentleman had his suprapubic catheter removed.
Oh, yeah.
He has passed a fair amount of urine, and I am about to run this scanner, simple bladder scanner, to tell us did he manage to empty his bladder. Simple bladder scan. It gives us lots of information. No pain, no nothing, just cold jelly. Want to film that?
Oh, yeah.
See that? See that there green circly bit? Yeah?
Yeah.
Yeah, so if I freeze that, that tells me that you've got 84 mils, and that tells me I am extremely happy.
Hey.
You emptied your bladder.
I'm extremely happy
It's a girl.
that you've passed 84 mils of urine. You're not in retention. You've not got any pain. You've not got any blood. For the time being,
That was all good.
cheerio. Anything under 150 mils residual urine,
Yep.
I'd consider perfectly fine.
All right.
Yeah,
That's good.
that's well under.
Yep.
And
Smash.
you've been drinking a lot of fluid,
Yeah, you're not kidding me.
so you're maybe producing a lot of urine at the moment.
Yeah.
So since you peed and then got here, you've produced 84 mils of urine,
Wow.
but it's in your bladder.
It's in my bladder. So I'm going to need to go 10 minutes down the road.
You
I'm gonna
probably
need to go
will. You'll probably be peeing for the rest of the day.
Can you give me a pee bottle so I can take it in the car? Just in case I hit traffic on the
Give you an
M80.
empty bottle of iron, bro.
Yeah, that'll do. That will do nicely. Thanks very much, everybody. This has been Bill Lightbody. What was your title again, Bill? It was very impressive.
Urology nurse specialist
With a degree.
with an RGN certificate, with a degree, and an
And he's also a bodybuilder as well. Show us your muscles, Bill. Look at that. Look at that. Not bad for 65. Look at that. Anyway, thanks very much, Bill. It's been a pleasure. Peace out.
I felt like I was saying goodbye to potentially the man that I married in a way. Not in, like, I felt like something was going to change afterwards. Your heart breaks for you.
Yeah.
As a partner, your heart breaks for you. But also, you kind of go through like a little bit of grief or something in your relationship that you took for granted, but it's a huge part. And you feel helpless.